Good morning, everyone, and thank you so much for taking the time for this discussion today. Uh, in an ambulatory surgery center, time isn't just money, it's patient outcomes. And every OR minute is scheduled, every staff hour is allocated, and every dollar is accounted for. So I want to make sure that this conversation earns its place in your day. This is not an IT presentation. It's not going to be one of those fear based cybersecurity talks. This is going to be a leadership conversation about protecting enterprise value inside your ambulatory surgery center. Because today, AI and cybersecurity sit directly in the lane of patient safety, regulatory compliance, payer relationships, and the long term valuation of the facility that you've built. Now, if you own, manage, or oversee an ASC, this affects you, not theoretically, but operationally, right now. So here's what we're going to talk about and walk through during this presentation. What's actually happening with AI in healthcare and ASC operations right now? What this quietly costs you in dollars, time, and patient trust? Where the biggest missed opportunity is hiding inside your facility, and what you can actually control as an ASC leader. And we're also going to talk about how to turn this risk conversation into a growth conversation. Now, at the executive level, this matters for one reason. Technology is now enterprise risk. It affects your payer contracts, it affects your accreditation status, and it affects your ability to recruit top surgeons. It also affects the valuation of your facility that you've spent years growing. AI is the most disruptive force in the healthcare industry, and it's one of the biggest forces that we've seen since electronic health records. Not because it's flashy, but because it accelerates everything. It accelerates clinical documentation, it accelerates prior authorization, it accelerates billing and coding, it accelerates supply chain management, and unfortunately, it also accelerates cyber attacks against healthcare facilities. Now, the why here is important. ASCs are uniquely vulnerable in their position right now. You operate with the data complexity of a hospital, patient records, PHI, payer data, surgical schedules, etc., but typically with the IT resources of a small business. And that gap is where attackers operate. When AI increases the speed of operations in a system built around protected health information, both efficiency and vulnerability increase simultaneously. And if leadership doesn't intentionally govern that speed, the ASC absorbs all of that risk by default. Now, cyber attacks targeting healthcare are rising, and ASCs are now a primary target. And in recent years, we've seen ransomware shut down surgical scheduling systems, forcing procedures to be canceled or redirected. We've seen credential theft expose patient records through third party EHR vendor portals. And we've seen phishing attacks impersonating anesthesia groups and surgical reps to manipulate financial transactions. And in 2024, Change Healthcare, one of the world's largest healthcare payment processors, suffered a breach that disrupted claim submissions across thousands of facilities for weeks. Most ASCs felt that directly. Now, why does this matter specifically to your facility? Because AIC operations are predictable. Surgical schedules are predictable. Billing cycles are predictable. And payer remittance timing is predictable. Vendor access windows are also predictable. Now, predictability makes you targetable. Think about that. Predictability makes you targetable. So, this isn't about fear, it's about understanding incentives and aligning your protection accordingly. So the leadership question becomes, are you ready? Not tool ready, not strategy ready, but if your surgical scheduling system went down tomorrow morning, do you have a documented protocol? If a staff member receives an email that appears to come from a payer requesting updated banking information for remittance, is there a verification process that would catch that? If a scrub tech or circulator uses a personal device on your clinical network, do you know what that exposes? And if your billing partner or EHR vendor gets breached, who from your team leads the response? The why here is simple. ASCs operate on precision, trust, and compliance. And when disruption hits a surgical environment, confusion escalates into liability within hours. Executive clarity can shorten that chaos, but that lack of clarity extends it beyond belief. Now, if you store patient records, process insurance payments, or transmit protected health information electronically, you're on the radar. Well, guess what? ASCs do all of those every day. You integrate with EHR platforms, practice management systems, anesthesia billing, medical device manufacturers, payer portals, and supply chain vendors. And here is where most ASCs are genuinely exposed. Most modern breaches originate through third party vendors, not your internal staff. You may have strong internal controls, but if your EHR vendor, your billing company, or your implant rep's portal has weak credentials, then you inherit that vulnerability. HIPAA doesn't distinguish between your breach and your vendor's breach. The liability lands on you. Now, at the executive level, vendor access and oversight are no longer administrative tasks. They are risk governance functions. So, at the same time, if you're not thinking about how you can use AI to improve ASC operations, then your competitors already are. And AI is being used today inside surgical centers to automate prior authorization workflows, reducing approval times from days to hours. And it's been used to flag scheduling conflicts and optimize or block OR utilization. It's being used to streamline clinical documentation so that physicians spend more time on patient care and less time on paperwork. Now, why does all of this matter? Because surgeons notice efficiency, payers notice accuracy, and investors notice margins. And the ASC that are positioning for acquisition or joint venture partnerships over the next 3 to 5 years are the ones building operational maturity now. Technology infrastructure is increasingly part of that valuation conversation. So doing nothing costs you. And most people say, I'm just not going to do anything. But that is it. There is a cost to that, but not just in breach scenarios, but in daily operational friction. Revenue leaks from when claims are delayed because billing systems are slow, misconfigured, or breached. Reputational damage that happens fast when a patient data breach goes public. And in healthcare, that trust is almost impossible to rebuild. Regulatory fines from HIPAA penalties alone can range from $10,000 to $2 million per violation category. And many ASC leaders aren't aware of exactly what triggers them. And let's talk about talent loss. Top nurses, surgical technologists, and clinical staff evaluate the quality of the tools that they work with. Outdated, unreliable systems are a retention problem. And, and then we have patient churn. When your facility has a reputation for technology instability or data breaches, patients and surgeons will choose different venues. So the why here, the reason that we're having this conversation is margin protection. In an ASC, small inefficiencies compound quickly across procedures and payer contracts. Small security gaps can become major liabilities. Leaders protect margin by reducing friction and preventing avoidable disruption. So let's talk about what you, as a business leader, have control over. Let me separate what's out of your hands from what is completely within your authority. Now, you do not control whether cyber criminals target ASCs this quarter. You do not control how sophisticated AI generated phishing attacks have become. And you don't control what vulnerabilities exist in your EHR vendor's infrastructure. But And you also do not control when the next change healthcare level disruption is going to hit that industry. Those are real. They're coming and they will continue, right? But you do control your strategy. You control whether your facility has a formal AI usage policy before staff starts using AI tools in clinical and administrative workflows. You control whether access to patient records is locked down and audited, especially for former employees, contractors, and vendor portals. And you control whether your vendor contract includes cybersecurity requirements and business associate agreements that actually hold those partners accountable. You control whether financial wire instructions have a verification step before funds move. And again, the why here is accountability. Payers, accreditation bodies, and regulators all evaluate whether leadership exercise reasonable oversight. Oversight is defensible. Neglect of that oversight is absolutely not. But you also control how proactive your facility is and who you trust as your technology strategy partner. Proactive ASCs reduce dwell time. That's the gap between when an attacker gets in and when you detect it. In healthcare, the average dwell time before detection is measured in weeks and sometimes months. A lot can be exfiltrated in that big of a window. And the speed at which you pivot matters. Facilities that have tested their incident response plans recover faster, spend less on breach remediation, and then return to normal operations sooner. And at the leadership level, proactive posture signals to accreditors, payers, and acquisition partners that this facility is run with discipline. So, again, here's what I want you to take away from this slide. Today's conversation is not a technology conversation. Yes, technology is the mechanism, but what we're really talking about is patient trust, regulatory standing, payer relationships, staff retention, surgeon loyalty, and facility valuation. And every one of those things is an executive responsibility. And every one of them is affected by how well your technology and your cybersecurity strategy is governed. This today is a business growth conversation. AI can reduce prior authorization delays, which means faster revenue collection. AI can improve can improve OR scheduling efficiency, which means more cases per block and more revenue per square foot. AI can assist with clinical documentation, which means physicians spend more time operating and less time charting. And a strong cybersecurity posture is now directly tied to your ASC valuation. So buyers and management companies perform technology due diligence. A facility with documented controls, clean audit history, and a governance structure commands better multiples than one that doesn't. And again, you built this facility, so protecting and growing that value is a leadership priority. And technology strategy is now part of that very important equation. You can leverage AI as your strategic edge. You can use it to reduce friction in prior authorization and revenue cycles. You can use it to streamline clinical documentation and reduce physician administrative burden. You can use it to optimize scheduling and OR utilization. But pair every AI adoption with governance. Define what tools staff can use, define what patient data can touch those tools, and define who is accountable. Because speed without control is simply fast exposure. The facilities that get this right will be the ones that attract the best surgeons, retain the best staff, and command the strongest valuations when it comes time for a transaction. So, how do you actually turn this into growth? Well, let's start with clarity, because you can't protect what you can't see. Conduct an external exposure assessment. This tells you what is already visible to attackers before you even have a conversation with anyone. Review your vendor access and permissions. Map who has access to your systems and whether any of that access is broader than it needs to be. Map operational friction inside your facility. Where are staff working around the technology rather than with it? That friction is a cost and it's often a risk. Then you can identify where AI can safely improve efficiency, starting with the workflows that they're currently costing you the most time and money. Growth rarely comes from dozens of initiatives. It comes from a handful of disciplined decisions that are executed precisely and consistently. Now, when you reduce exposure and reduce operational friction at the same time, something important happens. You stabilize the facility, you protect your reputation, you improve staff experience, and you increase surgeon confidence in your operation. This leads you to build the kind of documented, audible governance that makes your ASC attractive to payers, accreditors, and acquisition partners. That chain reaction, protection leading to performance, leading to growth, is why today's conversation matters at the administrator and ownership level. Over the next 12 months, you can expect continued pressure from ransomware targeting surgical scheduling and EHR systems. You can expect AI generated social engineering attacks to become more convincing. And you can expect payers and accreditation bodies to increase their scrutiny around data governance. Governance is becoming a leadership competency, not just a compliance checkbox on a form. So let me ask you a direct question. On a scale of 1 to 10, how important is it for your agency this year to reduce exposure, protect client trust, and position the ASC for long-term growth or future transaction? If your answer was below a 7, then the timing may not be right. And that's completely okay. Not every ASC is in the same place. But if it's a 7 or above, I want to tell you exactly what I would do right now if I were sitting where you are. I would look on the screen and I would go to the link in this slide. Oops. There we go. Or scan the QR code. So it's cydian.group/free scan, or again, you can scan the QR code. And you're going to run the free ASC exposure assessment before I even left today's conversation. And here's why. Most ASC executives already know there's a gap. They're not lacking in awareness. What they're missing is a clear picture of exactly what that gap is and what it looks like to an attacker right now. This assessment, I'm going to give it to you absolutely free, $1,000 value. This assessment gives you that picture in about 10 minutes, again, at no cost. It scans your dark web exposure, meaning any staff credentials that have already been leaked and are circulating online right now. It checks your external network for known vulnerabilities. It evaluates your DNS health, and it reviews your website for security gaps. There's no software to install, no IT team is required. Just click the link or scan the code, and 10 minutes later, and you'll have a clear result. This is something that agencies pay up to $1,000 for. And today, because you attended today's briefing, it's going to cost you nothing but 10 minutes of your time. But now here's what happens after that. Once you see those results, you'll have something that most ASC executives don't have: clarity. You'll know exactly what's exposed. You'll know exactly what the priority is. And if you want to talk through what it means for your specific surgery center, that's what the risk strategy session is for. It's no pressure. It's no sales pitch, just a focused conversation about what the results mean and what, if anything, makes sense as a next step. So here's my ask to you. Before you close this tab or leave this discussion, scan this QR code and go to the link on the slide. 10 minutes, no real cost. Get real answers about your agency. And then once you've got that information, if you want to talk about it, you can book a profit and growth strategy session with me at cydian.group/risk. You've spent years building your ASC, right? You deserve to know what's protecting it and what isn't. Once again, I appreciate you being here with me today. As always, we are always on and always ahead, and be absolutely kind to each other. Have a great day.